Hello, this is Professor Nassar, and in this lecture we are going to cover the gross anatomy of the isolated stomach. So let's start with the overall orientation. This is the anterior surface of the stomach. This is the posterior surface of the stomach. This is superior, inferior, left side of the stomach, right side of the stomach. This tube is where the esophagus would normally attach. This area is where the beginning of the small intestine would attach, represented here by the duodenum. Let's go through the general terms. From superior, the first section we look at is the cardia, or the cardiac opening. Again, when you're going through this, you should have your lab manual out so you can follow along with the terms that I'm going through here. This is the cardia, or the cardiac opening. It surrounds the cardial orifice through which food enters the stomach from the esophagus. This region here is called the fundus. It's dome-shaped, tucked beneath the diaphragm. This area, the majority of this region here, the mid portion of the stomach, is called the body. The body ends roughly about here. This region of the stomach, from the pointer to here, is called the pyloric part, or pyloric region. It consists of a few different subdivisions. This subdivision is called the pyloric antrum. This area here is the pyloric sphincter, or the pyloric valve. Normally, this sphincter is closed and regulates stomach emptying into the duodenum, or the beginning of the small intestine. The outside curve here is called the greater curvature. The inside curve here is called the lesser curvature. To the greater curvature attaches a sheet of mesentery that is called the greater omentum. You can see it here, this yellow line. The greater omentum usually is very fatty or riddled with fat deposits that give it the appearance of what's called a lacy apron. The reason why this structure looks yellow here is to represent that fat. The greater omentum attaches to the dorsal mesentery, which is basically coming from the dorsal or superior body wall from the inside of the body cavity, then takes this rather tortuous route, or rather elaborate route, and attaches here onto this aspect of the stomach. From there, this mesentery, which is a named mesentery called the greater omentum, continues over the surface of the stomach as the visceral peritoneum, and continues onward as the lesser omentum, which attaches to the lesser curvature of the stomach. So the greater omentum attaches to the greater curvature. The lesser omentum attaches to the lesser curvature. The lesser omentum is a continuous sheet of mesentery that starts with the greater omentum and continues along as the visceral peritoneum. The lesser omentum continues on to the liver. Let's open up the inside of the stomach, and we will see the following structures. Again, this region is the cardia, or the cardiac opening. There is a sphincter here as well, sometimes known as the cardiac sphincter or the lower esophageal sphincter. Again, this sphincter is normally closed, just like this sphincter, the pyloric sphincter, is normally closed. This sphincter regulates the passage of food from the upper esophagus into the stomach. This sphincter regulates the passage of food from the pyloric region of the stomach, from the antrum, into the small intestine. This is the fundus. This is the body. This is the pyloric region, the pyloric antrum, and the pyloric sphincter. Here is the greater curvature, the lesser curvature. What we want you to appreciate on the inside of the stomach are all these folds, which are called rugae. The rugae allow the stomach to expand after consuming food and liquid. So when the stomach is full and distends, The rugae basically unfold to allow the stomach to increase its volume. When we get to the small intestine, we will see folds that look like this but have a different name. They are called plicae. And the difference between rugae and plicae is that rugae disappear as the stomach distends and gets full of food and fluid. The plicae are permanent folds. We will see these in the small intestine in a later lecture. Okay, that's it for the gross anatomy of the isolated stomach.